Hello. The information blocking rule came out of the 21st Century Cures Act, which passed in December of 2016. The first phase of this rule took effect on April 5, 2021. The what now on this slide refers to the second phase of this rule, which took effect 2 months ago on October 6, 2022. Today, we want to explore what this second phase really means for all healthcare providers. My name is Bob Latz, and I'll be your host on this topic. I'm the Chief Information Officer for Trinity Rehabilitation Services, and we provide physical, occupational, and speech therapy in nursing homes and home health agencies. Because of this, I've taken leadership roles related to the information blocking rule for post-acute care within several groups. These include the HIMSS Long-Term Post-Acute Care Committee, the CHIME Policy Steering Committee, the American Physical Therapy Association Post-Acute Care Work Group, and ADVION, formerly called National Association of Support to Long-Term Care. In short, I've been following this rule for several years. Before we get into the what now of this rule, let's take a few minutes to make sure we're all thinking the same about this topic. First, a disclaimer. This presentation and any ensuing discussion does not constitute as legal advice. It's intended for educational purposes, and it does not override anyone's need to exercise sound professional judgment in specific circumstances. This presentation provides information based on the 21st Century Cures Act, as well as clarifying information from the ONC and other organizations. The information blocking rule comes out of Section 4004 of the 21st Century Cures Act, which was signed into law in 2016, December of 2016. In this, there's four key points. One, that the Health and Human Services Secretary is authorized to establish reasonable exceptions. Also, second, the ONC is tasked to implement standardized processes for reporting claims. So ONC is the one that has to create this process for reporting and follow up on those claims, but it's the OIG that's tasked with investigating those claims. And then finally, inside of the Section 4004 is the definition of information blocking. This definition really shows that practices that prevent or materially discourage the access, exchange, or use of health information, so any practice that materially does this, and for which the actor knows or they should know, are likely to interfere with the EHI access or exchange or use. If those two things are in place, then it would be considered information blocking, and the person or entity that is doing those practices is the one that would be held liable for that blocking. So, what is electronic health information? This is one big question that has come up. And really, if you look back at the original definition, it said it's information that's included in a designated record set. Doesn't matter if it's maintained by the provider or by the actor or for an actor, but if it's required to comply with HIPAA, then it's electronic health information. And on and after October 6th, so what we're in right now, it's electronic PHI as defined by HIPAA. That's everything in the electronic health information definition. There's two things that are not included. The first of those is psychotherapy notes. And this is, again, has been in place since the beginning, since April of 2021 when the rule took effect. Psychotherapy notes were not included, nor was any information that was compiled in a reasonable anticipation of legal proceedings. So those are two pieces to keep in mind about what's not included. Now, who are the actors that are can be accused of being an information blocker? Well, first off, these include healthcare providers. We'll talk more about that in just a minute because that's our big point here in this talk. This also includes health IT developers of certified health information technology. That means if they have anything inside their organization that is certified, then everything in that organization falls underneath the information blocking rule, and that entity is an actor in that instance. And then the third is either health information network or health information exchange. Now, coming back to that definition of healthcare providers that we were just talking about a moment ago, comes this question of what is a healthcare provider? And inside of the ONC rules, they point out that healthcare provider, excuse me, inside of the information blocking rule, it points out that healthcare providers are identified under 42 U.S. Code 300 JJ. And on the right, you can see a list of those different individuals or professionals who would be identified as a healthcare provider. The next question usually comes into play is related to penalties. And the penalties, and you can see this here, this is from an earlier slide. We're going to talk more about penalties in a moment. But in essence, the penalties for healthcare providers are yet to be decided. That means they're not out there yet. We don't know what those penalties are. We do know that those penalties do go back to the date that the information blocking rule took effect, which means in essence April 5th of 2021. We also know that there are penalties for health information networks, health information exchanges, up to $1 million per violation. And the same with health IT developers, up to $1 million per violation. And then health IT developers could also get banned from having a certification, having their product certified again in the future. The next piece that comes into play, again, I talked about this definition, just showing it here again, but the next piece that really comes into play are the exceptions that can be used, right? There's 8 different exceptions to information blocking, and 5 of these are related to fulfilling requests, and 3 are related to procedures for fulfilling those requests. So again, think of these 8 exceptions as acceptable reasons to not share information. So if you don't have one of these 8 acceptable reasons to not share information, then you have to share it. And if you're not sharing it, then yes, you could get a claim against you for blocking information. Now, the other piece that comes into play is the actors, again, healthcare providers for purposes of our conversation today. Actors have significant discretion and flexibility in determining how to document these exceptions. So it doesn't mean that you can't use them, you can, but you must document somehow why you are using them and how. So now that we understand the basics of the information blocking rule, I want to talk about the updates from October 6th. And the first of these, again, we've talked a little bit about the electronic health information and what it is. And there's been a lot of pushback and discussion as to what this really means. And what the ONC has come back with is that it is essentially your designated record set based upon what's in your policies and procedures. So in those policies and procedures, if you have identified your designated record set, and most healthcare systems, they do have a policy that will identify that designated record set. But some of the smaller providers, as well as some nursing homes, other healthcare providers that I know, may or may not have a policy at this time defining what their designated record set is. And if we don't have that policy, then in essence, what that means is that we have to provide everything that we maintain electronically. Second piece here, again, we've talked about the exceptions a moment ago. When those exceptions are in place, when appropriate, we should use those exceptions. And when we use those exceptions, we should document on them. And how we document, that's up to us, but you do want to document in a way that you can find the documentation and that you can retrieve it if there ever is an OIG investigation. Third, the penalties, and we talked about these a moment ago, and I shared that the penalties for providers are not yet out there. But again, I do want to point out that it has been clarified that these can be retro back to the beginning of the rule. We gave a lot of pushback to ONC about this because we don't think that's right. If you don't know what the penalties are, it shouldn't be in place at this point in time. But I will share that they have pointed out that they'll be looking at each case on a case by case basis. And part of what that means is that the only way that they're going to go back to a retro to the beginning of the rule, I believe, and again, this is just thoughts here, the only way they're going to go back is if it's a very egregious error that is going on. So if you have a behavior, if you have a process that's in place and you repeat that over and over and over again, and you intend to continue repeating it, then they're probably going to follow it back further. The second thing I'll share on a case by case basis is that if you are a large healthcare organization like the Mayo Clinic and you have a huge IT department, they're going to probably expect different things out of that kind of a setting than they are if you are a small provider, maybe a single provider in a setting. They may expect different things out of that situation. So again, they're going to be looking on a case by case basis. They're going to be looking at what we do and how we do it. And those are big deals, very important for us to keep in mind. Now, next, I wanted to go into a few different scenarios, and these come straight from the ONC. And these are scenarios that they provide. And you'll notice on the left, it's a practice example, and off to the right, it says where you can learn more. Underneath of that, it'll give the frequently asked question number, and it will identify within that number a little bit more information about where you can learn more. So in this first one, it's basically an example. If I have a patient portal in place and that portal has the capability to give information directly to the patient or to allow patient or caregiver to request transmission of their electronic health information to other individuals immediately, and I choose not to enable that, is that an information blocking? You'll see off to the right, there is a plus there that it would likely be an interference. There are several of these on each page. I'm not going to go through all of them, but I will pick one off of each page just so that you know where we're at. Um, the next page here talks about, it's related to business associate agreement. The first one here, if I enter into a business associate agreement that prohibits or limits the access exchange, then is that likely to be an interference? Is that likely to be information blocking? And the answer is yes. And I wanted to point this one out because of the importance that we need to have with taking a look at our policies and procedures and also looking at our business associate agreement. Um, Not going to go into the second one there. This one talks about how much information do I need to share? So if I try to tailor the amount of electronic health information that I share without artificially restricting or influencing the scope of a request that was made to us, would that likely be information blocking? And again, earlier I shared on a case-by-case basis is what the ONC and OIG are planning to look at. That's essentially what that comes down to. Um, the next one that I wanted to bring up, this one's a big deal because if I fail to comply with another law to share data, for example, if the law requires that I must report public health information such as vaccine status, and I don't share that information, is that likely to be identified as information blocking? And the answer is yes. That could be. And if that's identified and found in the process of other things, then a information blocking scenario can be brought against you as well. So again, there's several different scenarios that are out there, practice examples. I do want to go into a couple that have come up recently. The first one is related to an attorney and their request for medical information. So, attorney asks for electronic documents for a patient that was treated by the provider. Records are not received in several days. Then the attorney claims that the provider is creating unnecessary delays that limit their timeliness to the electronic health information. Or a related scenario, the attorney comes up to you and says, I want everything you have on Mrs. Smith because she's now a client of mine. In that second scenario, in both of these scenarios, you first have to consider who is a legitimate requester. If it's an attorney who's requesting, we need to first make sure that they have HIPAA legitimacy in making that request for that individual. Second, determine the reason that they're asking for the information. Underneath the information blocking rules, if you're an actor, such as a healthcare provider, you can't ignore these requests from a legitimate requester. Because if you do, yes, you can be accused of information blocking. So we need to take a close look at what that is, when they are making the request, what the request is for, and then, yes, we do need to get the information to them in a timely manner. Also, take a look if you have processes in place in your organization or a policy that's in place that may be causing that delay that's there. On a separate note, I will share that the ONC has pointed out that, let's say your electronic health record doesn't pull all of your information together, and you have to have an individual who's actually going out and getting that data and putting it all together in a packet so it's provided for them. If that's the case, you can charge for that time to do that it takes for that individual beyond what the system is able to do. But you cannot charge just because it might take that long. You have to be able to document, etc. Second is a question about lab report and access to the power of attorney or to the patient. And in this case, physician in a skilled nursing facility orders a lab test, and the results come back in the afternoon, and the POA, the power of attorney, wants those results right now. However, we had already been asked by the physician not to share those results until the physician first sees them and has the opportunity to talk with the patient. Is this information blocking or is it not? And part of it is going to depend again on your policies and procedures. Part of it is going to depend, is this a specific situation for this patient? And the physician is concerned about potential harm to that patient. In other words, can we use any of the exclusions that were there? And if I can use those exclusions in this specific scenario, then I can document and I'm okay. If the physician says no patients get any results until I see them first, then that would be considered information blocking. And I bring this up because of the importance to educate everyone involved in the care of that individual as to what we need to provide. A third scenario comes up if I'm changing electronic health record vendors. So I want to change EHR products and I want an electronic download of my data from my current provider. Can I get that? And in essence, yes, you can. If the vendor says they can only give it to you, for instance, in PDF format, but they are already transmitting to other electronic health record um, settings in other formats, then that's not good enough. They do need to provide it to you in a machine readable format, something that you can use. Again, there's more information about this, but we wanted to make sure everybody understands that one. Finally, if the patient is discharged and they're going, in this case, discharged from skilled nursing facility, they're returning home and they're going to go to the senior center and the senior center is requesting the medical information from, in this case, skilled nursing facility, could be any provider, and the skilled nursing facility says they cannot send it due to HIPAA requirements. Well, then the question really becomes, what is the HIPAA requirement, or what is the HIPAA um, concern that's in place? And let's say that the senior center is asking us to send it to them in a Microsoft Word format and send it to their Gmail account. Well, then I may have HIPAA concerns because of the privacy rule, and I may not want to allow the data to be sent in that format. But that is different than if the senior center has a very secure method. I can send it through encryption, and I can send it in, for instance, a PDF that they can read and use, or in a machine readable format that they can import into any electronic health record that they might be using. So again, all of those pieces come into play in terms of what we are looking at with this. Finally, just to wrap up, what does it really mean for us? It means that we need to prepare, and there is a checklist at the back in the resources, but we need to prepare for this information blocking rule by going through a checklist, making sure we have everything in place. Part of this means reviewing our policies and procedures, looking at our business associate agreements, looking at our current workflow request for process for requests that come in for information. Very, very important to take a look at that from beginning to end. Review the systems and technology. What capabilities do we have? When do we need manual involvement? And how much of that manual involvement will it take? And we need to engage and educate everybody that we're working with. Yes, our software vendor. Yes, our employees. Yes, the resident and caregivers that we work with. Then two, just review and stay up to date with information from ONC, looking at their blogs, looking at their news comments. And remember, it is going to be looked at on a case-by-case basis. So really, the information blocking rule, why? What does it matter? This is really why. It's really not about information blocking, but about information sharing. And in this picture, there's brothers, sisters, aunts and uncles, grandparents, friends, colleagues, and others. These are people who need their data shared so that the best care available can be provided to them. We need to keep all of them in mind as we think about complying with this information blocking rule, information sharing rule, and do so in the best way that we can. Thank you very much for your time, and I look forward to talking to you further at the conference. Have a great day.